Oftentimes, I've heard that either the research isn't there or it doesn't work. Your favorite athletes have been doing PRP for several years, and the military has been doing it as well. It's definitely beneficial and shows that it does a great deal for healing and prevention of further injury. What's up, everyone? Hope you're doing well. Today, we're talking PRP or platelet rich plasma because it's pretty cool. And for me, it was very beneficial for a chronic injury that was going on with my knee. So, I wanted to explain what it is, how the process works, and then what to watch out for because I contacted a clinic and of course they're doing it a way that I isn't the most beneficial for me as the person paying for the procedure. So, starting off, what is PRP? Essentially, what they're doing is concentrating your platelets, which are found in your blood. So, you have erythrocytes, your red blood cells, leukocytes, your white blood cells, plasma, which is the majority of it, and then your platelets. They isolate the platelets and then inject it into an injured site. So it's super neat because it's coming from inside you. And what it's doing is these platelets are essentially working as like a foreman on a construction site. So they're in that area, in that injured site, managing the growth factors and cells and healing factors in that area to come repair and rebuild that injury. So it's pretty cool. So let's take a tendon, for example. A lot of people have knee pain, and patellar tendonitis is fairly common. What's challenging with tendons is they lack a lot of vasculature. So when you don't have a lot of vasculature going to that area, you're therefore not getting a lot of blood flow, and then it's not bringing any oxygen carrying capacity or nutrients to that site. And if it's injured or was injured years ago and is now not repaired well, then it would be beneficial to get more blood flow to that area. Well, platelets, PRP, is going to introduce a growth factor called VEGF, or vascular endothelial growth factor. This specific growth factor introduces angiogenesis, or new vessel growth. Therefore, it's going to create new microvessels in that area to help bring nutrients to it. There's a few other growth factors that go into it that help that process we were talking about, that recruits other things in that area and then helps promote proliferation or cell division and cell growth. So it's a very potent healer. So another cool thing about this is that it can potentially re-kickstart the healing process in an injury that happened a long time ago. So it can potentially kickstart the healing cascade again in that previously injured site, helping build back and sort of restart the process in there, which would be super advantageous if you have scar tissue buildup and the collagen didn't build back well. The key ways that it works and the process that you go through is essentially you go in, they'll draw out blood, and the research that shows the most benefit is around 60 cc's of blood. They're going to pull this out and then they're going to spin it in a centrifuge. Now, one big thing that they should be doing, and talk to the person about this, is they should be double spinning it, which isn't always the case. The reason you want to double spin it is because the first spin kind of gets the blood and plasma and platelets all separated, but you have platelet rich and platelet poor plasma. Then they're going to spin it again, and they're going to separate the platelet poor and platelet rich plasma even further. And this is shown to be like 4 times the amount of concentrated platelets, which is what you want, because then you're getting the most benefit and millions of platelets in this double spin. So once they double spin it, they're going to draw it up into a syringe, and then they're going to do an injection into the injury site. So if that's a tendon, they're going to find the tendon under ultrasound and then inject into that tendon. And it's pretty interesting because you can see the tendon, then you can see the PRP injecting into the tendon, which is an important point to bring up too, because I spoke to a clinic in my area and they don't do it under ultrasound, which is wild because you don't have x-ray vision, you're not Superman. You aren't going to be able to tell if you're in the tendon or the injured site. Oftentimes the response to that is, well, I go off feel, and when I hit a lot of resistance, I know I'm in the injured site. That's crap. And the research shows it. The instances of getting in the injured site are at 90+% when you're under ultrasound, where they range from like 30 to 60% if you're just doing landmark orientation. If they're not using an ultrasound, they are doing you a disservice, and you're potentially not going to see any benefit. Another thing that you should not get in conjunction with the PRP is lidocaine injections. Lidocaine is a numbing agent that's turning off the nerve communication in that area. Therefore, you're going to have less pain with the injection. Mine was directly into the patellar tendon. It was not super enjoyable, but it was worth it in the end for me. Lidocaine is cytotoxic and is actually disadvantageous and has shown that it reduces the amount of VEGF that is proactive in the area, in the injured site. You don't want to get lidocaine injections before you get the PRP injected. Another thing you'll hear is that the science is it out and whatever else claims they want to make because they want to give you a cortisone shot. Cortisone shots are catabolic and induce more potential injury and induce the likelihood of a worse injury, therefore leading to surgery. So PRP is your own healing juice inside you, and the biggest potential bad thing that could happen is they don't use a sterile technique and introduce an infection, but that could happen with any injection. So double spin, ultrasound, no lidocaine, and then after the procedure, do not use NSAIDs or acetaminophen because it inhibits the ability for those platelets to do their thing. You want them to call out and recruit prostaglandins and all these things in the injury cascade. You don't want to diminish that. When you get the injection, it's going to be sore for a little bit, potentially for a few days. Just ride it out. And then after you are in the healing process, the recommendation is to not use NSAIDs or Tylenol. And then also consider it's not great to take movement out of your life, especially when you get injured. So you want to continue to do your normal thing, but also you shouldn't be, going for a new PR on squats or doing a marathon or a new running program. It's a build back process. You want a good balance of movement, but also not over hindering the ability for it to heal back. PRP was super beneficial for me. I got an injection in my knee for some chronic issues of pain and locking and then giving out. And since then, it's been super, super game changer for me. And it's a very simple procedure to do. Just ensure that make sure the clinic's doing the right thing, because if they're doing all these other things and they're just going off field, that's like fairly incorrect to do. That's not ethical. There's a lot of good research that shows it grows back your articular cartilage, which specifically in the knees, which is beneficial because a lot of times we see a breakdown of the articular cartilage in the knees. Therefore, that leads to bone on bone and you have arthritis in the knee. Well, PRP has shown over the course of several months to thicken that articular cartilage back, therefore preventing osteoarthritis of the knee and bone on bone, which is pretty cool. That's very hard to do, and especially if you get a cortisone shot. Check out the video I did on it, but it talks about how it actually breaks down that cartilage and could quicken the bone on bone potential. So the whole point of it is to make a long-term investment, especially dealing with chronic pain is miserable. And if you are dealing with chronic pain, there's some tweaks you could make. And this is a pretty simple tweak. It was worth it for me. And let me know if you can find a clinic that does the double spin at 60 cc's without lidocaine under ultrasound injection, because I haven't come across very many. That would be the right way to do it. There's also some ongoing research on how PRP can actually help with stem cell injections and how you can put the two together. And PRP is essentially a carrier for the stem cells directly to the injury site, which is super interesting. So share this with somebody that is potentially going to get a cortisone shot, struggles with knee pain or any other injury, a tendonitis, and like, subscribe, and share. See you next time.